Excellent. Thank you all for joining us today. My name is Jennifer Schultz. I'm the Senior Vice President of Marketing and External Relations for OU Health. Welcome to our media briefing on addressing nursing challenges in Oklahoma. When the people we serve, patients across the state of Oklahoma, are in need, OU Health is driven to take an active role to meet those needs. Healthcare facilities around the nation are experiencing a critical shortage of nurses, and OU Health is no exception. According to the Federal Bureau of Health Workforce, Oklahoma has 44,200 nurses, which translates to 11.1 nurses per 1,000 people. Across OU Health, there is a 19% nursing vacancy rate, and that is not a new situation. There has been shortages of nursing across the country and the state for years. According to the American Nurses Association, there will be more registered nurse jobs available throughout 2022 than any other profession in the United States. Many factors contribute to the increased need. An aging population is driving demand for healthcare services, and nurses who are baby boomers are getting ready for retirement. On the other side of the coin, as the largest nursing college in Oklahoma, the Fran and Earl Ziegler College of Nursing at the University of Oklahoma Health Sciences Center conferred 287 nursing degrees to its graduates this spring and expect an additional 65 graduates this summer, including 2 doctoral candidates. This fall, they have 404 undergraduate nursing students admitted, 59 graduate students, and 2 doctoral students. This increased interest in nursing programs is certainly exciting, but it is not an immediate fix. Today we are here to announce some important changes for OU Health that allows for opportunity in our nursing workforce. It will also bring real solutions to longstanding healthcare challenges, a shortage of nursing professionals in patient care roles. Our presenters today include Dr. Julie Hoff, OU Health Interim Chief Nurse Executive and Dean of the OU College of Nursing, and James Brigida, a registered nurse and supervisor of the OU Health Trauma Emergency Department. Our first presenter is Dean Hoff, who is leading the effort to transform the nursing enterprise across OU and OU Health in ways that address the shortage, improve patient care, and create a better work-life balance for nurses. Dean Hoff.
Good afternoon, everyone. Thank you for being here. And thank you, Jennifer. As you all know, nurses play a very critical role in the care of each patient, and healthcare systems operate best when we have a full staff of highly educated, compassionate nurses who work in a collaborative setting. Being a nurse today can be difficult, and we will continue to face challenges as we respond to an increased demand for healthcare services, as well as the COVID pandemic that continues in the United States. But together we are creating an atmosphere at OU where nurses are acknowledged for what they bring to the table, and it's important to us that they feel valued. It would be impossible to overstate the adversities our teams have experienced in the last 18 months, especially those involved in direct patient care. And I just want to take a minute and cheer them on, because these nurses are still facing COVID patients every day. Through it all, the strength and compassion of our incredible nursing team has been our shining star here at OU. They not only proved invaluable to caring for patients through numerous critical situations, but they also became their friends and their families when hospitals were forced to tighten visitation policies. But that's just a small example, yet a very important one, of how valuable nurses are to hospitals and physician practices. OU Health is engaged in some of the most groundbreaking treatments and range of comprehensive services we provide is highly complex. We are Oklahoma's only level 1 trauma center for adults. We have the most technically advanced pediatric critical care options in the state, which live in the only freestanding children's hospital in the state of Oklahoma. We have robotic surgeries, the latest generation of cancer therapies delivered by the state's only NCI-designated cancer center, and we also conduct breakthrough clinical trials. As Jennifer mentioned, OU has a great tradition of proactive responses, confronting challenges, pursuing solutions. As the largest college of nursing in the state, the Fran and Earl Ziegler College of Nursing is part of that tradition, and leaders are invested in meaningful initiatives that are more than symbolic. We are committed to change that creates substantial and long-term gains, not only for nurses, but for the patients we serve. I am proud to announce that OU Health and the College of Nursing are joining forces to launch initiatives that will build and support a more educated, engaged, and effective nursing workforce. Through these programs, we aim to make OU Health the employer of choice among nursing professionals. The impact on improved patient care will be nearly immediate while positioning OU Health and its workforce for growth and success. These changes that I'm about to announce apply primarily to our Oklahoma City-based roles, and that has to do with where we're at in our integration process, but we anticipate that these opportunities will expand across the entire OU Health enterprise. The OU Health College of Nursing brings many resources to the challenge of growing and retaining the nursing workforce, not only at OU Health, but for similar institutions across the country. Our vision for OU Health Nursing is to foster a culture of excellence, inclusivity, innovation, and teamwork. Flexible options for work and attaining education are areas of focus as we plan for the future nursing workforce at OU Health and for Oklahoma. And I'm going to be a little selfish here, as I plan for the nursing workforce I need in a college of nursing as well. As we transform our nursing workforce in the new OU Health integrated academic healthcare system, we are rolling out incentives and creating a roadmap for growth. We are distributing a news release that provides more information on the programs we're going to be providing, so I am going to go over each of them briefly, and I'm happy to answer any questions you have afterwards on the specifics. Our new opportunities will include relocation and sign-on bonuses. Additionally, we're offering a weekend program, a travel at home program, and what we describe as a nursing degree accelerator program. Under the OU Health weekend program, nurses will work 4 12-hour shifts in a 2-week period. So 4 12-hour shifts is 48 hours, and they will get paid for 72 hours. To enhance the flexibility of this program, nurses can split the weekend shifts with a coworker. And this program will really be focused on serving in our greatest need areas first and our greatest kind of time frames first. The compensation structure under the new OU Health Travel at Home program uses the traveling nurse model without any overhead. The program allows nurses the option of a higher hourly rate in lieu of benefits, unless required by law. As many of you know, evidence suggests that the education of the frontline nurses impacts patient mortality, morbidity, and failure to rescue in acute care hospitals. The OU College of Nursing Degree Accelerator Program will provide scholarships to the OU College of Nursing and continue with our tuition reimbursement program to any accredited nursing program. But the programs are different because the scholarship program will provide all the tuition and fees for any nurse that attends OU College of Nursing versus a tuition reimbursement model if they choose to go outside of OU. These programs and initiatives are aggressive, they're proactive, and they're long overdue. We are partnering and collaborating in innovative ways. More importantly, our efforts have yielded constructive and strategic solutions that address the complexities of caring for a broad range of patients with unique healthcare needs that are sustainable with potential for ongoing development. Thank you very much for your time, and I look forward to your questions.
Thank you, Dr. Hoff. I want to underscore the value of the relationship between OU Health and the Fran and Earl Ziegler College of Nursing at the University of Oklahoma Health Sciences Center. It is this kind of partnership that encourages and drives leading-edge approaches that are both creative and effective. These comprehensive and expansive initiatives are concrete examples of our commitment to our nursing workforce and to building the nursing workforce for Oklahoma. We believe these tools will make a significant difference in employee engagement that will promote retention as well as recruitment. Our last presenter today is James Brigida. James is a registered nurse who has been working with the University of Oklahoma Medical Center since 2003. He has worked as a flight nurse, paramedic with MediFlight Helicopter, and then went to work in our trauma ER 10 years ago. 2 years ago, James became the Trauma Emergency Department Supervisor. James is going to tell you about his experience as a nurse at OU Health.
Hello. My name is James Brigitta, and I'm a proud nurse here at OU Health. I have worked here for 18 years, and throughout those years, I have seen amazing growth, change, and progress. My time in the trauma ER is where really I started to appreciate the intimate impact that we as nurses can have on patients. This is the ultimate reward for us nurses. We want to help people. And if you ask many nurses why they started in this profession, I suspect they will tell you that's the reason. OU Health is the only level 1 trauma center in the state. And what that means is our emergency department cares for the highest level of critically injured patients in the state of Oklahoma. With these often horrific injuries comes the most critical and preciously limited time to intervene and resuscitate. It is in these moments that we as nurses, as part of a specialized trauma team comprised of the most amazing trauma surgeons and advanced practice providers, are able to use our years of training, education, and skill set to deeply impact our patients and save lives. This impact is immense, but the impact it has had on me personally is far more profound. To say I love my job here at OU Health is an understatement. However, the last year and a half have been tremendously difficult. The pandemic has brought about unprecedented challenges and has been a heavy burden on all medical personnel, but especially nurses. The pandemic has exposed and magnified a problem we have long known existed, the nursing shortage. The nursing shortage that we often have talked about over the years in casual conversation is now a true national crisis. Throughout all ERs, there is a struggle to get and keep nurses, asking them to work often understaffed, underpaid, in an environment with the highest level of acuity and stress. I know the struggle to hire and keep nurses is not one owned only by the ER. Every department is facing this nationally. But in the ER, it has crippled us. If the floors are not staffed appropriately upstairs, then we can't get our patients admitted to a room. And without that happening, we can't function like an ER should. We end up not having an open room to care for our next patient. Ultimately, the nursing shortage has left us all tired and weary. I say all this to be upfront and transparent about the real issues we are facing as nurses nationally. Part of the reason that I'm standing here today is a gesture of appreciation to the institution that I have always loved through good and bad. They're willing to acknowledge and face this national crisis head on with measures like they have announced today. They are long overdue, but they are here, and that is a huge step in the right direction. Hopefully, this will be just the start of additional measures to ensure the health of nursing here at OU. This leaves me encouraged that the future for nurses at OU Health is bright. Thank you.
Thank you for sharing your story, James. We appreciate the contributions of many colleagues who have worked with dedication and diligence throughout the course of the COVID-19 pandemic and as we look at our future state of nursing at OU Health and OU. We also want to thank those that have helped us to work on developing and implementing the new initiatives and opportunities announced today for nurses at OU Health. I see this as only the beginning of what we can accomplish at OU Health, a fully integrated academic healthcare system, which will give the best to our students, to our employees, patients, and to the state. We will be taking questions, so this concludes our media briefing. Dr. Hoff and James will be available if you did want to ask them further questions. Members of the OU Health media team, if you can raise your hand, you can go over and talk with any one of them to be able to further discuss this with Dr. Hoff or James. So thank you so much for coming and have a great day.